We are at the ASH meeting on hematologic malignancies. You know, the guidelines say it's perfectly fine, but what's the relative effectiveness of 3 versus standard 6 cycles of R-CHOP in the setting of early stage diffuse large B-cell lymphoma? We actually have an answer for that now, and it's from an analysis of the National Cancer Database. And to talk about it, I'm with a second-year internal medicine resident from Memorial Hospital of Rhode Island, Jala Fala. Thank you very much for spending a few moments with us. And the question that I have is, there has been some conflicting data along these lines, isn't it? So I suspect that's one of the reasons why you did this study.
Yeah, actually there's controversy about the optimal management of early-stage diffuse large B-cell lymphoma, and we don't know which factors affect the clinician's decision in choosing one of these treatments. 6 cycles of R-CHOP chemotherapy with or without radiation versus 3 cycles of R-CHOP chemotherapy with radiation. So we did this analysis to see which factors affect the clinician's decision and to model to see if there's any association between treatment selection and overall survival of these patients.
So you use the NCDB, so hopefully you've got a lot of patients here and you've got some answers. How many patients were you able to analyze?
We included 31,236 patients in our analysis. And 17.5% of them, which was about 5,400 patients, were in the 3-cycle chemotherapy with radiation, and the rest of the patients, which were about 82%, were in the group of 6 cycles of chemotherapy with radiation.
Wow, that's lopsided, isn't it?
Well, yeah, actually there were only 1 in 6 patients with early-stage diffuse large B-cell lymphoma receiving abbreviated chemotherapy with radiation. So this low proportion can be due to some factors we are not aware of, like bulky tumors can affect the selection of treatment method. Right. And of course, also there may be poor adherence to treatment guidelines, as we saw that some patients who were supposed to receive radiation therapy, at least half of them were not receiving any radiation.
Well, of course, if there's controversy, people may just go for the 6 instead of the 3 anyway because you don't have an answer. Do we have an answer now?
Well, actually this data set is not the answer for evaluation of the effect of treatment selection on survival. So we may need more analysis, like prospective analysis.
Right. So what did you learn?
Well, here we learned that which factors, some socioeconomic factors are also related to treatment selection, which may indicate disparity in access to medical care in the United States. We have to use different data sets, or we may need to do prospective studies. As I mentioned before, this data set is not appropriate for this kind of analysis.
So what do you want to do next?
Well, right now I'm working on another project, which is follicular lymphoma. So we are comparing 2 different treatment approaches for the management of advanced stage follicular lymphoma.
So did you have fun doing this?
Yeah, even in my free time, I enjoy doing research, because as a resident, you're really busy working in the hospital, taking care of the patients. So it is really difficult to find free time in order to do scholarly activities. So for now, I'm just using my free time, my weekends, my vacations to do research.
So we have a variety of stories coming at you from ASH Clinical News, so please look around. There's some online and, of course, some in print. And for ASH Clinical News, I'm Rick McGuire.